Okay, so today we're going to cover the parathyroid gland and parathyroid hormone. Now, if you look at the thyroid gland and you were to turn it around, now it's not showing on this model, but I'll have a picture up here. There are usually 4 parathyroid glands embedded in the posterior aspect of the thyroid gland. Now, parathyroid gland, it's kind of easy, it produces parathyroid hormone, so PTH. Now, there's one function of PTH, okay? The one function of PTH is to regulate blood calcium or to increase blood calcium, okay? Now we know calcium is important for bones, but calcium is even more important for nerve conduction and muscle contraction and things of that nature. So, your body will pull the calcium out of the bone to put it into the blood if need be because it's a higher priority. So there's one function for parathyroid hormone, that's to increase blood calcium, but it uses 3 mechanisms. Now I'm going to make a little side note here because I think this is important. When you get your calcium checked, you go to the doctor, they check your calcium, they are not looking to see if you are getting enough calcium in your diet. That does not check your calcium status. What that checks is exactly what we're talking about here. Is the parathyroid hormone working properly? So is this hormonal balance working to keep your blood calcium within normal ranges? Because again, your body will pull the calcium out of the bone to make sure you have enough in blood. So if the blood level is normal, it does not mean you're actually getting enough blood calcium. So keep that in mind. Now, if our one function for parathyroid hormone is to increase blood calcium, how does it do it? It uses 3 mechanisms. The one mechanism is sort of what I've alluded to. We're going to break down the bone. So what it does, it stimulates these cells called osteoclasts. Osteoclasts break down bone. If you've taken 201, Anatomy 201, you know that osteoclasts are these bone breaking down cells. And so what it'll do is it'll break down the bone, and the bone is primarily made of hydroxyapatite, which is calcium and phosphorus. And so by breaking down the bone, it releases calcium and phosphorus into the blood, thereby raising calcium levels. So that makes sense, okay? So the second thing, it's going to stimulate vitamin D to be hydroxylated in the kidney. What does that mean? Well, the vitamin D, in order to be active, has to go to the liver. It's hydroxylated there, and then it goes to the kidney. It's hydroxylated there. Not so important to know what hydroxylation means in all of this. What's important to understand is it becomes active after that hydroxylation in the kidney, and parathyroid hormone is what causes that or stimulates that hydroxylation in the kidney to happen. So it's basically what stimulates vitamin D to become active. Now, vitamin D increases and is necessary for the absorption of calcium. So when we release parathyroid hormone, it actually increases the active vitamin D levels, which are going to increase the amount of calcium you absorb from your diet, supplements, fortified foods, or whatever. And so again, raising blood calcium levels, if that makes sense. The third thing we're going to do with parathyroid hormone is going to go to the kidneys. Now we will lose or can lose some calcium in urine through this filtration process. What we're going to do when we release parathyroid hormone is we're going to reabsorb, which means go from the kidney tubules back into the blood. We're going to reabsorb calcium, which again, that's going to raise calcium levels. So the 3 things are break down bone to release calcium into the blood, increase the absorption of calcium in the small intestines, and 3, increase the reabsorption of calcium in the kidneys or kidney tubules back into the blood. And so by doing that, we've essentially raised blood calcium levels. Now, this is a negative feedback mechanism. So what happens is your calcium goes low, you release parathyroid hormone from parathyroid glands into the bloodstream. It then goes to its appropriate organs to cause these 3 mechanisms to cause the raising of blood calcium. Once we hit normal levels of calcium, we shut off. Now this regulates most of the homeostasis for your blood calcium levels. However, if blood calcium levels were to rise high, there is another hormone produced by the thyroid, and that is called calcitonin. An easy way to remember this, if the first 2 letters are CA, you can think of that as calcium, and N at the end. So what it does, it puts calcium in the bone. So it does the opposite of what we see parathyroid hormone doing. It actually takes the calcium from the blood and puts it into the bone. And so it lowers the blood calcium levels. That has a very minor or negligible effect in humans because we usually can regulate that with parathyroid hormone and then just using that negative feedback to shut it off. However, we do have calcitonin if necessary. If you have any questions, let me know. Stay strong. I'll see you next time.